Great. I'm starting to see we have folks from all over the country, which is really exciting, from Memphis and Washington, D.C. and Tallahassee. And so we're really excited to have everyone here. Well, I want to be mindful of everyone's time, so we're going to get started. Just a few quick moments of housekeeping here. We will have time for question and answer later on in the presentation. And so at the bottom of your screen, next to the chat button, you should see the Q&A button. Please be sure to use the Q&A button as it helps us track and be able to answer your questions. But submit those questions throughout the presentation wherever you have it. Our expert panelists and speakers will be able to kind of address those as they come out. And please know that this presentation is being recorded. And later this week, we'll actually share a link to this presentation, all the resources that are discussed in easily identifiable format. And we encourage you to share this with other business owners in your network and your employees, as well as some of the information included could be really valuable for them. And so without further ado, it's my pleasure to turn the presentation over to Tricia Sandiego, Senior Advisor with AARP, who will give the presentation. Later in the presentation, we'll also be joined by Rebecca Kinney from ACL, who will give some remarks about the SHIP community and how they can be available and beneficial to your business. Well, Tricia, over to you. Thank you all again for joining us. We're really excited to have you. And Tricia, take it away.
Thank you, Colin. And thanks for everyone for joining and taking time today. This is really sort of the basics of Medicare, Medicare 101. It's for your business and your employees, but also for you. Perhaps you're just trying to get a handle on the fundamentals of Medicare and trying to navigate your own situation. Perhaps you're a caregiver and trying to navigate for a loved one. And so hopefully this will kind of give you the good building blocks on how to understand Medicare and the different parts of it. It can get real complex really quickly, and that we hope to kind of boil it down in digestible chunks for you today. So thank you. I'm seeing everyone drop in the chat, and it sounds like we have people from all over the US, and so I really appreciate it. As you know, I'm Tricia Sandiego from AARP's Family Caregiving and Health Team. We provide a lot of education on caregiving topics as well as Medicare. And today we'll be covering the basics of Medicare and telling you some tips on how you can help people in your company, your organization, in your family, trying to navigate it. And so this is what we're going to cover. We're going to cover those basics. There's a lot of different parts to Medicare that will kind of break down and help you get a firmer understanding. We'll give you some tips on how you can educate your employees about Medicare. Many employees who are approaching age 65 may choose to continue to work past age 65. We're seeing a lot of trends of people kind of working past that age. And sometimes that's causes a lot of questions about healthcare coverage, how that kind of works with Medicare, as well as the existing coverage that you might have. And then there's also some employees who may choose to retire, and sort of what do they do when they make decisions around their healthcare coverage. Some real important choices to make. But then we'll also provide some resources and tools. Resources that you can use as an employer yourself, and then things that you can kind of pass on to your employees that are going to cover the consumer related topics related to Medicare. Next slide. So what are the kind of common questions that you may get? What are the common questions that we have heard from business owners, from employers? Even just real simple basics like, what is Medicare? How is it covered? What does it cover? When should I enroll in Medicare? That can be really tricky because there's multiple enrollment periods, and we'll go over that today. What are the penalties? What happens if I don't enroll in Medicare and I don't have coverage? There are repercussions for that. And so we want to make sure to educate you all, and that you have the information that you can equip your staff so that they can avoid those kinds of mistakes and penalties. And how will Medicare work with my existing healthcare? You all may be providing healthcare coverage through your company, and there's sort of coordination between Medicare and the plan that you have that needs to kind of go into effect, and it's something that you kind of have to get a good understanding of, so you know sort of what's primary and what's secondary. So those are the types of questions that I've heard. I'd love for you all to drop in the chat any of the questions that you may have heard from staff who approach you, especially if you're in, like, let's say the HR benefit space, or if you're a small business owner. What kind of questions do you have? What kind of questions do you get? And what kind of questions do you have? Feel free to drop them in. We'll try to get to them at the end of the session. I think we should have some time. Next slide. So what is your role as a business owner? Are we thinking that you should be the end-all be-all knowledge expert on everything there is to know about Medicare? No, we would not put that on you. We know that it can be complex and it's a lot to understand. And you also don't want to provide the wrong kind of advice that may misdirect some people and choose the wrong coverage decisions around their Medicare and their healthcare coverage. So you have to be very confident in really knowing, you know, some of the details about Medicare if you want to start, you know, if you are even going to go down that path of providing advice. I don't think you want to provide advice and tell people what to do with their health coverage decisions, but you want to connect them with resources. You want to provide them with educational materials about Medicare so they understand the basics. You want to provide, you know, third-party, unbiased sources of information that aren't trying to just sell a plan to them. You also want to help your Medicare eligible employees avoid enrollment penalties. So your role could really be more just of a reminding function. Can you remind your employees who are approaching age 65 or who are approaching retirement, the kinds of things that they need to consider? Can you provide them with lists of questions that they should ask themselves so that they can make the right choice? So you're not really prescribing the choice that they should make, but you're helping them think through the things that they need to think about within their own lifestyle that will help them decide their Medicare coverage. Next slide. So what is Medicare? Medicare is a federal health insurance program for people who are 65 and over. It's also available for some younger people with certain disabilities and for people with permanent disabilities, such as end-stage renal disease and people with ALS, also known as Lou Gehrig's disease. Next slide. Employees are responsible when it comes to things that they have to pay for, the costs. You are going to maybe be familiar with these because they're just regular insurance terms, things like your monthly premium. That's going to be the amount that any individual would pay to Medicare or a private insurance plan for an individual's healthcare and prescription drug coverage. That's a monthly amount that you have to pay. There's going to be the deductible, the amount an individual would owe for healthcare services that the health plan covers before your health plan begins to pay. So it's a certain limit that you need to spend sort of out of pocket before insurance kicks in. Co-insurance is the amount an individual may be required to pay as a share of the cost for services after they pay any deductibles. This is usually expressed as a percentage. On average, in general, for Medicare at least, you're going to be expected to pay about 20% in co-insurance, and Medicare will cover approximately 80%, and that's just an estimate. Co-payment is the fixed amount an individual would pay, excuse me, for a covered healthcare service, usually when they receive the service sort of at the point of transaction. The amount can vary by the type of covered healthcare service. For example, your primary care physician, you may have a copay amount that's set for something like, I don't know, $25 to see a primary care physician. You have to pay that every time you visit them. But let's say a specialist is $40 copay. So those are just examples, but things that you need to think about in terms of just understanding how to kind of navigate all this insurance terminology. That all these terms apply in Medicare as well, in the Medicare world. Next slide. One thing I wanted to point out before we go into what Medicare covers is just putting it up front, what Medicare does not cover. And this can often be surprising for a lot of people. Medicare does not cover vision. It's not going to cover things like eyeglasses and annual exams and that kind of thing. It doesn't cover dental unless it's sort of medically necessary and medically needed. It's very rare that it's going to cover dental coverage. It won't cover hearing as well. So things like hearing aids and oftentimes the tests for diagnosis. What I think is most surprising to many people is that Medicare does not cover long-term care. You think a federal insurance program for age 65 and over will cover things like paid caregiving support for a home or a home health aide to help with things like activities of daily living. Those are not covered through Medicare. They may be covered by other state-based programs like Medicaid, but it's not covered by Medicare. So these are things that we just want to say up front that I know can be surprising to people. Next slide. So let's go into the different parts of Medicare. And this is where it kind of becomes alphabet soup really quickly. You may have heard that Medicare has multiple parts and that there's different parts and they're based off letters. There's Part A, Part B, Part C, Part D. Sometimes it goes all the way down to, supplemental plans will go down the alphabet. But let's just give you the basics on the individual parts because it's good to kind of have a firm understanding of that. Part A is hospital insurance. It's going to cover things like your inpatient hospital stays and hospital cares. It may cover some hospice and home health care, but not all. I mentioned that Medicare generally does not cover long-term care, but then there's some hospice and home health care that is covered. And it may cover some skilled nursing facility care. Next slide. The costs for Part A. Typically, there's no monthly premium for Part A. You've sort of already kind of prepaid for that through the taxes that you paid through working. So most people, if you've worked a certain number of quarters, are eligible for Part A premium free. The deductibles in 2022 for Part A are $1,556 for days 1 through 60 of inpatient care. Then the deductible can be applied again for additional hospitalizations after 60 days. One thing to note is that in 2023, Medicare just released the costs and the deductibles and premiums for the multiple parts of Medicare. And I believe the deductibles for Part A are going to increase in 2023 by about $44. I think it's like $1,600 or something for the premium, the deductible for Part A. Next slide. Part B. Part B is going to cover medical insurance. This is going to be things like your doctor visits, your outpatient hospital services, durable medical equipment. Those are things like wheelchairs, walkers, hospital beds, for example. It covers rehabilitation therapy, laboratory tests, x-rays, mental health services, and some preventive services to help maintain your health and detect problems early when they are at a more treatable stage. That's Part B, it's medical insurance. Looking at the costs for Part B, the standard premium, monthly premium in 2022 has been $170.10 per month for those enrolling in 2022. There are changes for 2023. The Medicare Part B premium in 2023 is actually going down $5.20, and it's going to go to $164.90. So that's a little bit of good news there. Similarly, the annual deductible for Part B is actually also decreasing from $233 in 2022, and it's going to go down to $226. So that's the last bullet that I have there. But just taking a side note here, we do want to mention that monthly premiums do increase for those with higher incomes. This is called an IRMA. It's called the income-related monthly adjustment, and there's limits to that. So individuals whose income is more than $91,000 are likely going to be having this tacked on additional payment to their monthly premium. Couples who earn more than $182,000, the same thing applies for them. Next slide. Medicare Part C. It's not really a part, actually. It's another pathway, separate from Medicare Part A, B, and D. Part C is a wholly other way to get your Medicare coverage. Part A and B, and sometimes D, we'll go over that shortly, is often referred to as original Medicare or traditional Medicare. It's kind of getting your Medicare services a la carte. You have Part A, you have Part B, and then you end up purchasing a Part D plan if you want that prescription drug coverage. Part C is sort of an all-in-one type of way to get your Medicare coverage. These are mostly run by private insurance companies. They're very similar to HMO type-based insurance. And Medicare Advantage is another term for Part C. Medicare Advantage plans, they are just alternatives to original Medicare. They are plans offered by private insurance companies, and all plans will include at minimum Parts A, hospital, and Part B, medical. In most cases, it will cover Part D, which we will talk to about shortly. Part D stands for drug coverage. Having a Medicare Advantage plan has its advantages and disadvantages. And so you have to see what things are important to you in your healthcare coverage and make that decision and assess whether you want to use this alternative approach to getting your Medicare that's separate from original Medicare. And so there's lots of kind of things to consider, things like region, the network of providers that are accepted within the network, within the Medicare Advantage plan. You want to look at costs. You want to look at coverage. Oftentimes, Medicare Advantage plans may have some little bonus features. Next slide. So Medicare Advantage, how it works. I mentioned some of the factors to think about. Geography is one of them, and region. Most times Medicare Advantage plans are going to limit you. You have to live in that plan service area to be eligible for a particular plan. So when you're shopping around, you will have to kind of look at what's available in your area, what is available for you to purchase. You may have to use providers in the plan's network, and this is most likely the case. You have to stay in network in order to reap the benefits of the most cost savings. If you go out of network, you may get little to no coverage of or any financial support there if you are going to go out of network of providers. You may even pay an additional premium on top of that standard Medicare Part A and B premiums that we talked about. And you may have to follow insurance company rules, such as requiring a referral every time to see a specialist. So there are some limitations with Medicare Advantage, but then there's also some benefits, and you just have to see if it appeals to you. If your doctor happens to be in the plan's provider network and you're in that region and you want to stick with the same doctor, that might be something that you want to consider. Another thing, if you're someone who travels a lot, maybe the Medicare Advantage plan is not something that you can, that's very portable, that you would have service and coverage if you go and spend, half the year in another part of the country. So you may have to look into another option for that. So these are kind of things to consider when you're weighing the pathway that you're going to get your Medicare plan. Are you going to go with original Medicare or Medicare Advantage? Next slide. So I kind of went on the sidebar and talked about Part C, Medicare Advantage plans, but going back to sort of original Medicare, there is another part called Part D, which stands for prescription drug coverage, D for drugs. The Part D plans are going to help cover the cost of prescription drugs that you pick up at the pharmacy. And these are also run by Medicare-approved private insurance companies. Medicare Part D is one area where you do need to do some shopping around. Part D plans are run by Medicare-approved private insurance companies, and to get prescription drug coverage, you must join a plan run by an insurance company approved by Medicare. If an individual is eligible to join, but they do not, you could get a late enrollment penalty. So for every time that that you don't have that, what we call creditable drug coverage, is when you may incur penalties. Medicare Part D is provided by standalone Medicare prescription drug plans and by Medicare Advantage plans that offer coverage for both prescription drugs and healthcare. So Part D, if you're purchasing an individual prescription drug plan, that's only required if you are using original Medicare and you have your sort of Part A and B a la carte. If you have a Medicare Advantage plans, I mentioned that most likely they'll cover prescription drugs. Next slide. So the cost for Part D in 2022, people enrolled in Part D, they are they need to pay monthly premiums as well as co-payments or co-insurance. And there is an annual deductible of up to about $480. Similar with Part B, with that income-related monthly adjustment amount, there are people, if you have higher incomes, you're likely to have to pay higher Part D premiums. I will mention that for 2023, I believe the expected monthly average cost for Part D coverage is expected to be around $31.50. That's a slight decrease from 2022, which was about, on average, people paid $32.08 for their monthly premium for Medicare Part D. Next slide. Okay, so going back to the choices, and there really is sort of one main choice to make up front when you're enrolling in Medicare for the first time. It's the choice between, do you want to go with the a la carte with original Medicare, Part A, B, and then if you need it, Part D. You may even purchase a supplemental plan, which is called a Medigap plan, and I can talk a little bit more about that later, but that's sort of one way to get your Medicare coverage. The other pathway is if you choose to go Medicare Advantage, which is known as Part C. So both are provide coverage, but you just need to see what works best for you. And this is where I caution people to be careful when it comes to providing advice, because there's so many individual factors to think about, and it's purely on preference for an individual which way they want to go. Next slide. So I talked about original Medicare. It's a fee-for-service way of getting your Medicare coverage. It includes Parts A and B. You generally can go to any provider that accepts Medicare. And most providers in the US will accept Medicare. Some may not be accepting new patients, so they may, decline your appointment request. But in general, most providers will accept original Medicare. What you would do for Part D is you would shop around and you would choose and join a Medicare prescription drug plan for the drug coverage. So it's that A and B plus D a la carte. That's original Medicare. Next slide. So when do employees enroll in Medicare? There are multiple enrollment periods, and we're going to kind of go through each of the individual types of enrollment periods, because that can also get confusing, just like the parts, pretty quickly. Next slide. We'll talk about first the initial enrollment period, and that's signing up for Medicare for the first time. Initial enrollment is usually around the age of 65, and it's kind of centered around the month of the 65th birthday of that individual. There's a special enrollment period for those who missed out on their initial enrollment period because they maybe already had coverage, like an employer-based plan, and they want to continue with their employer-based plan. You're allowed to do that without penalty in most cases. And when you are ready to join Medicare, you would have sort of a special enrollment period that is kind of centered around when you lose your coverage or choose to, let's say, retire, for example. And then lastly, there's an open enrollment period, and that's actually happening right now. The annual open enrollment period for Medicare is from October 15th through December 7th. And open enrollment period is only for those who are already enrolled in Medicare. So it's not, this can be confusing, but open enrollment is not for someone who's joining for the first time. We'll go and dig a little bit deeper in these enrollment periods in the next slide. As I mentioned, initial enrollment is centered around that 65th birthday. So this is where we think employers can really play a critical role when it comes to reminding around the 65th birthday, perhaps in advance of that, a few months before. You can let them know, hey, why don't you get started trying to learn a little bit more about Medicare and decide how you're going to get your Medicare. In general, if employees are receiving Social Security already, they are automatically enrolled at age 65. Employees do have 7 months to enroll. You have the 3 months before the month of the 65th birthday. You have the month of the 65th birthday, and then there's 3 months after the 65th birthday. And we really encourage everyone who's enrolling for the first time to enroll in the first 3 months. That will help to sort of avoid any kind of lapse in coverage or any kind of delays. And it's kind of good to get it done before your actual birthday. Late enrollment often means that you will pay higher Part B and Part D premiums, and that's due to penalties. There are penalties that you get that are incurred because you did not enroll in Part B and Part D when you should have. Next slide. Talked about that special enrollment period. Special enrollment is for employees who do not enroll in Medicare when they're first eligible, but and it could be for a very valid excuse. For example, if you are covered by an employer health coverage. Let's say you're over age 65 and you're currently working and you're already covered and you don't want to do that. Special enrollment is also triggered if employees lose their employee coverage for reasons such as like at the end of their employment or at the end of their coverage. The coverage just ended. So the special enrollment 8-month period will kick in. And that's going to be a time that's sort of centered around that individual's timing. So that's a special enrollment period. Next slide. The open enrollment period, which I mentioned, is happening right now. This is a time where you hear lots of ads for Medicare plans, individual types of plans that you can purchase. People may get a lot of sales calls, and there's just a lot that you kind of hear about because of the open enrollment period. There's a lot of shopping around and choices that people can make during this time if you're already enrolled in Medicare. It allows enrollees to switch Medicare Advantage plans and join, switch, or drop a Medicare Part D plan if you're wanting to shop around. Medicare eligible employees are not allowed to join during open enrollment. So if you are joining for the first time, unless your 65th birthday kind of centers around the open enrollment period, open enrollment is not for those who are joining for the first time. I will encourage everyone, if you already are enrolled in Medicare, to really take the time to assess your plans that you have. And even if it's just for a few minutes, see if you could be more satisfied with a different plan. Plans change from year to year, and things like Medicare Part D, for example, their coverage changes. Perhaps the list of approved drugs changes from year to year, and maybe your drugs that you take are no longer covered, or maybe there's better coverage with another Medicare Part D plan. All the Part D plan providers have these sort of negotiated rates with the drug companies and with Medicare. And so you want to kind of continue to stay on top of looking at your needs, your healthcare needs, and looking at all the individual plans that you're enrolled in. And you may sort of be happier in another plan. If not, if you're completely satisfied with what you already have, you really don't have to do anything during open enrollment. But we always encourage you to take a look and assess. All right, let's talk about penalties. This is where an employer or small business owner, you could really play a good role in preventing these, what you want to do with those reminders. There are penalties when you don't have Medicare and didn't enroll in Medicare and you should have. So Part A, the penalty is there's a 10% increase, up to 10% increase for monthly premiums for twice the number of years not signed up, but you could have. Part B, there's a 10% increase for monthly premiums for each 12-month period not signed up. The penalty will stick for as long as you have Part B coverage. For Part D, you would multiply 1% of the national base beneficiary premium. So that's sort of like the average premium, monthly premium. You multiply that by 1% times the number of full uncovered months you didn't have Part D or creditable coverage and you could have. I want to call your attention to the Part B penalty in particular. This penalty is locked in for the remainder of someone's life as long as they have Medicare. They can have a dramatic impact on one's healthcare, which is why employers need to be thoughtful of the way they educate and engage their employees and that sort of reminding function that we're encouraging you. Do the little nudge around that 65th birthday, around the special enrollment period, to encourage employees to avoid these penalties by signing up at the right time. Next slide. So Medicare and your business. Now that you have some familiarity with Medicare as a program, and those were really just the high-level basics that we provided, we know that there's so much more in-depth information that we could go over, and lots of individualized questions that I'm sure many people have, and it can get confusing really quickly, but those are the basics. Now that you have a solid basic foundation, the rest of the session is really focused on what this means for you and how best you can educate your employees. One thing to note is that employer size does determine Medicare requirements. How Medicare interacts with existing employer coverage is determined by the number of employees. For large employers, the work-based coverage is the primary payer, with Medicare providing secondary coverage. For small employers, it's the opposite. So I think 20 is a magic number. Fewer than 20 employees, you're considered that sort of smaller business. And in that case, eligible employees must enroll in Medicare, and the Medicare becomes the primary insurance. Any work-based coverage that may or may not be offered ends up being secondary. Some employees may not know how many employees work at your company, so be sure to indicate to your employees whether or not your business is classified as small. Since Medicare is the primary payer for small employers, employees at small employers must sign up for Medicare, or they will have a gap in benefits, and they may be responsible for those penalties that we mentioned. Kind of sticks with them for life as long as they have Medicare. Employees is counted as 20 full or part-time employees. And the flip side to that is the large employees. So large employees, employers that have more than 20 employees, they're going to be eligible to choose to enroll in Medicare if they would like, or they can stay on their work-based coverage. And in which case, if they do decide they're going to end up staying with work-based coverage, the work-based coverage is primary and Medicare becomes secondary. Next slide. So here's common scenarios. There's a few common scenarios that most employees will choose. Since Medicare is the primary payer for small employers and failure to enroll may result in uncovered medical expenses, the vast majority of employees will enroll in Parts A and B during that initial enrollment period. This is for small employers with 20 or less employees. For large employers, there's 3 scenarios that are likely to occur. There's lots of variation, but this is typically what to expect from employees. One point of complication is that employees may receive coverage from a spouse's employer, and that impacts an employee's decision-making. So that's another thing to consider and to sort of nudge employees about when they're reviewing their coverage and making their choices during initial enrollment period. Part C and D may also be included during the scenarios listed here on the slide. But for large employers, there's one scenario where they decide to go ahead and enroll in Parts A and B during the initial enrollment period. Then there's another scenario where you enroll during initial enrollment for Part A only, because I mentioned that Part A is normally premium free at that point for many people who have worked. They end up delaying Part B. And that's allowed to do that when you work for a large employer and you have a special 8-month enrollment period when you are ready to do it, assuming that the employee is still covered by the employer plan. You can delay Part B because then that way you don't have to pay the monthly premium for Part B on top of your employer plan. And you do that until enrollment during the special enrollment period. So when you retire, when you lose that coverage through your employer plan, you can then start paying for Part B and enrolling. Then there's scenario 3 where you delay both Medicare Parts A and B until enrollment during a special enrollment period. Next slide. So here's a proposed education timeline. Again, pushing that reminding function 6 months out before the 65th birthday of your employees. Can you send sort of an overview letter that just talks about Medicare and just gives a little nudge about, hey, this is something you may want to start learning about and deciding what's important to you and what preferences you have for your health coverage. About 3 months before the month of their 65th birthday, that's when initial enrollment period opens for that individual. Could you send another communication about that and maybe even provide some Medicare educational materials from an unbiased, trustworthy source? We have a lot at AARP, but Medicare.gov could be another resource as well. And we'll talk about some other really great resources. But initial enrollment period will start that 3 months before the month of their 65th birthday. That's another critical point in time. And then their 65th birthday, when you send them a birthday card or a birthday notification or something, could you also provide another reminder with lists of resources where they can turn to, who they could call if they wanted to talk through what their options are, if they had any questions, who are those unbiased resources that they can turn to. And then maybe do one final push right before their initial enrollment period ends. One final reminder, one other nudge that your initial enrollment period ends. If you're in a small business, you kind of have to enroll in Medicare in order to avoid gaps in coverage, because the employer plan will become secondary only to Medicare as primary. So you have to enroll in Medicare, and Medicare has to pay as a primary first in order for the secondary plan to kick in. And so if they want to avoid gaps in coverage, lapse in coverage, and if they want to avoid those penalties that we talked about, the sort of 10% for every 12-month period that they could have enrolled in Medicare Part B and didn't, that premium increase is going to stick with them for as long as they have Medicare. So you're trying to help with those two things. And here's really where we think you can play a role. As you can see, it's not telling them what choice to make. It's not asking you to be a Medicare expert. It's really just reminding and pointing people to the right resources. I think that's basically what our next slide talks about is your role is providing that clear and consistent communication, and it's referring. It's referring employees to those trustable and reputable resources. Brokers, stakeholders will compete to get the attention of Medicare eligible people, especially now during open enrollment. You see that a lot. To help protect your employees from people bombarding them, only connect them to these unbiased sources of information. You also want to educate employees about Medicare prior to eligibility. Before they turn 65, give them that letter that has all the links of resources, provide pamphlets or workbooks about the basics of Medicare. Educate your employees about this program and what the transition could look like. Employers should talk about Medicare during an annual review times with employees or during your company's open enrollment fair, benefits fairs. It's a good time to kind of talk about Medicare, and even if it's not for themselves, if it's them trying to navigate for their loved ones, there's many people who are caregivers for loved ones who are age 65 and above. So there's a lot that you can do in terms of support. Next slide. So let's talk about those resources. You may ask, I don't want to bring people, point people to biased resources that may provide the wrong guidance. You can't go wrong with Medicare.gov. Medicare.gov is the official website for Medicare. Medicare is administered by the Centers for Medicare and Medicaid Services, the federal agency on Medicare and Medicaid. If their employees have a specific question about their own Medicare benefits or plan, point them to Medicare.gov, or they can call Medicare directly at 1-800-MEDICARE. That's 1-800-633-4227. If they have questions about the choices of plans, there's multiple tools on Medicare.gov where they can shop around, things like a plan finder, as well as a tool that helps compare, I think, health providers. So there's lots of great tools. And then I'll also talk about a really good resource called the SHIP, the State Health Insurance Assistance Program. And that's why we have Rebecca Kinney here with us today. Before we go to SHIP, I'll mention Medicare Right Center is another great nonprofit resource that we collaborate with at AARP. Their website is medicarerights.org. But I mentioned the SHIP. The SHIP is the State Health Insurance Assistance Program. They really provide great one-on-one, unbiased counseling on how to sort of navigate Medicare and make choices and know what your options are. So without further ado, I'll pass it over to Rebecca Kinney from SHIP, who's here to talk more about the services they provide.
Great, thank you, Tricia. Can we go to the next slide? So as Tricia said, my name is Rebecca Kinney. I am the director of ACL's Office of Healthcare Information and Counseling. Essentially, we're responsible for the Medicare-related programs that ACL administers. And to give you a sense of who we are and what we do, I want to first tell you a little bit more about the Administration for Community Living, or ACL. We are an operating division under the Health and Human Services, which is focused on helping older adults and persons with disabilities across the lifespan live healthy and independent lives in the community to the greatest extent that they desire. We help across the lifespan with programs to assist the beneficiaries themselves, but also their families and caregivers, depending on what the needs are and the desires of the individuals that we are serving. And of course, my programs fall under that in assisting those with Medicare navigate their choices and also protect themselves from fraud. Next slide. I'm going to share some a little more specific information about the SHIP program. The State Health Insurance Assistance Program is a nationally funded network of local community-based organizations that provide assistance to Medicare beneficiaries and their caregivers to understand and navigate Medicare. We have a network of over 2,200 local programs and over 12,500 counselors. Those counselors are about 50% volunteer. We rely very heavily on volunteers to assist with this program. The other half are typically what we call in-kind. Those are individuals that work with other local community-based organizations. They may be employed at a senior center, a housing complex, home health agency, things like that, where they're providing assistance to Medicare beneficiaries already, but they also want to provide a little more in-depth help with Medicare. We provide approximately 2.5 million one-on-one sessions annually. 40% of those are during the annual open enrollment period, which we are in the middle of right now. Those one-on-one counseling sessions average just over 30 minutes. That means that sometimes we spend quite a bit more time than that with beneficiaries, sometimes less, to really help them understand their Medicare choices and make educated decisions. We also do outreach. So we go out into the community and provide general education. Very similar to the presentation that you saw today from Tricia. We'll provide an overview of what Medicare is. Sometimes we focus on different aspects of it, depending on the needs and the desires of those that we are working with. And one of the things that I want to encourage all of you to do is to reach out to the SHIP in your area, because they are more than willing to come out and do those sessions for your employees. So if you are a larger group and you have a number of people that are approaching retirement or are of Medicare eligibility age and are interested, the SHIP is more than happy to come out and do a presentation specifically for your employees. If you're a smaller employer and that doesn't make sense, I'm sure the SHIP would still be interested in working with you to get your employees to a session that they're doing in the local community. We are in every state, DC, Puerto Rico, Guam, and the U.S. Virgin Islands. So we should have someone local who's available to either provide one-on-one assistance to you or your staff, their family members, or to help you with outreach. You can find us at our shiphelp.org website. From there, there's a couple little orange circles on the screen here where you can find your local SHIP. If you click on the locator, it'll ask you which state you're in, and it'll connect you directly to the SHIP in your area. You can also call a 800 line, which will also be used to geo-route you to the SHIP in your area to get those connections. The one caveat I will say is, because we're in open enrollment, right now this is the busiest time of year, because we are a volunteer reliant program. Some of them may be booked up already for this period until December 7th. So if you call right now, you might have a little bit harder time getting a hold of someone than you would outside of open enrollment. But either way, I encourage you to reach out, see what's available, and definitely consider the SHIPs to help with those some more complex Medicare questions that you may have.
Thank you so much, Rebecca. I also just have to put in a personal plug. There's many family members and people I know who I've referred to the SHIPs because they just provide that great counseling that you really can't get anywhere else. It's hard to find someone who you can talk to on the phone. And so it's a really great service, and make sure that that's something that you can refer your employees, your loved ones, or you can call yourself for your own situation. Really great service. Let me go over very quickly AARP's resources. We have a lot. Medicare education is one of the fundamental things that we do at AARP as part of our social mission part of our work. Our main website is aarp.org/Medicare. There's tons of articles and tools on aarp.org/Medicare where you can learn more about Medicare and again, direct your employees to. We recently launched a new tool. On the next slide, it's called AARP's Medicare Enrollment Guide. And this is particularly helpful for those who are enrolling for the first time. It is a straightforward way to learn about enrolling and sort of the things that you need to consider. It's available at aarp.org/learn-Medicare. It's a step-by-step guide. You're not providing, so much personal information that, you're concerned about what you're inputting, but you are telling us a little bit about your situation. Are you working? Are you retired? What kinds of factors that you're interested in getting with your coverage. And the Medicare Enrollment Guide will provide that sort of customized response to what you need to do around initial enrollment. So it's very useful. And again, that's available at aarp.org/learn-Medicare. We've received sort of rave reviews about how it just makes Medicare kind of boiled down and digestible and easy to understand. As easy as it can be, I guess. I want to point people to our webinars. We have ongoing webinars available at aarp.org/Medicare Employer. Sign up for our Medicare webinars. They have all different topics that we cover, including the basics. So if that's something that you want to provide to your employees at an on-demand way, or if there's a live upcoming one, they can register and join. If they miss it, no problem. We have the recordings and they're all available on that website, aarp.org/Medicare Employer. And so that's a really good way to, for those that might not be able to do sort of a lunch and learn session at a given time, these are available and recorded, and you can encourage people to watch it on demand. So overall, I wanted to say thank you for tuning in. We're not done yet. We have a few minutes. I want to say thank you so much for listening. I know I probably went fast, and it was, even though it was just the basics, it was still a lot. It's a lot to take in. Medicare with the sort of alphabet soup gets confusing, and that's okay. A lot of people experience that, but we're here to help, and there's resources available to you where you can point people to, or if you're trying to learn yourself. So thanks for tuning in for that. We also provided those tips on how to educate your employees about Medicare. And we also have resources and tools. And guess what? After this session, we will send them via email to you all who participated, anyone who registered. I know there was a lot of questions about whether or not the information provided here will be available, and it absolutely will. If not, you're always welcome to contact us. Before I go over to questions, I do have a favor. I'm wondering if you all could take a quick poll. It should just appear on your screen right now. We want to know how we're doing and whether you found this information valuable and useful. Any topics that you are interested in, questions, please feel free to drop in the Q&A portion of the Zoom, or you're welcome to drop them in chat. We have just a few minutes to be able to try to cover them, but I would just like to hear, do you feel even just a little bit more prepared to talk to your employees about Medicare? Do you think your employees would find a session like this useful? AARP would be delighted and happy to partner with you and your your organization to deliver free educational sessions around Medicare. I could provide a session similar to this, catered to your employees. If there's a specific topic you want to deep dive into, please let us know. We want to know the feedback. What are the things that you all need in your company, in your organization, to help consumers sort of navigate the Medicare world? So thank you for completing that and for your time. And we have a few minutes for questions. Colin, do you want to read them out loud, the ones that we're able to get to?
Yeah, absolutely. And Tricia, we have a lot of questions coming in, which is very exciting. And I just want to echo what I'm seeing in the chat and feedback from everybody. That as always, this has just been such great information. And so thank you to Tricia and to Rebecca for taking the time to present and provide all this nuggets of wisdom about Medicare, and hopefully folks found it interesting and valuable. We had a lot of different questions that you covered, in some of your remarks, but I was hoping if you could talk a little bit again about the penalties and how those are different and what employers need to be thinking about for their employees.
Sure. We can maybe go back to that slide that lists it and repost it. I think the penalties, again, will be incurred if you don't enroll in Medicare, and you should have, or you could have. And there's different penalties based on the parts. And so the Part A one is up there, up to 10% increase for monthly premiums for twice the number of years not signed up. So that's not one that's sort of in perpetuity like Part B. Part B is the one that I think does end up really burning a hole in your pocket if you didn't sign up for sort of multiple 12-month periods. That's a 10% increase for monthly premiums for each 12-month period not signed up, and the penalty will stick for as long as you have Medicare Part B coverage. There are some examples where if you have a lot of financial hardship and you're not able to pay the premium amount, there are sort of savings programs that people may be eligible for. And if you become eligible for Medicare savings programs, I think that is one exception, one situation in which the Part B penalty may be something that's reduced or removed. But in general, Part B is one to flag. If you don't sign up for that medical coverage when you should have, you're going to incur that penalty. Part D, I believe, is not a lifetime penalty like Part B is. You will multiply 1% of the national base sort of average premium amount times the number of full uncovered months you didn't have Part D or creditable coverage. I'll double check, but I don't believe that one is a lifetime one. So 1% of this year's average premium was $33.37. May not be as much, but all of this adds up. Healthcare is such a major cost as people age, and every little bit helps. And so there are these penalties. On the flip side of that, I mentioned there are some financial supports available through programs like the Medicare Savings Program. I believe there's a Part D sort of limited income subsidy program. It's called the Extra Help Program for prescription drug coverage. There's a state pharmaceutical association that can also see if there's support available for you. So yeah, there's penalties, and then there's also on the other end of things I'll mention is that there is some help for paying for Medicare costs.
That's great. We did get a question that came through asking about the employer size distinction and how that relates with full-time employees versus part-time. I don't know if you want to just take a moment to kind of remind folks about that distinction as well. And I can quickly go back to that slide.
Sure.
And then talk about the full-time versus part-time distinction, if there is one.
I believe that the way that it counts for the 20, it's full-time and part-time. So it's let me double check, but I believe that it is the 20 number that's counted is full-time and part-time. Employees is counted as 20 full or part-time employees. There is an exception for the small employers. For employers with fewer than 20 employees, suppose an employer participates in a multiple employer or multiple group health plan, and at least one participating employer has at least 20 full and or part-time employees. In that case, the large employer rules apply. So that is a very unique exception, but there's always exceptions. These are sort of general kind of cases that we're talking about. What's important is to go over with your HR benefits department sort of what the rule is, what your official employer size is, and kind of work from there.
Awesome. And I know CMS has some guidance online about that as well. So if
absolutely
any small business owners are interested in that, it would certainly direct you to take a look at it, and feel free to email me and I can direct you to the right spot. I did see a question come through about if there's an employee that has disabled veteran benefits, how does that work with Medicare? Trisha, I don't know if you are in the spot to answer that, but I did see that question come through a few times.
Yeah, that's a unique situation. I believe there is going to be some sort of coordination of coverage. I believe that the veterans program is going to be offered through TRICARE for Life. I have to double check which one's primary and which one's secondary. Rebecca, do you know?
Yeah, so it depends on what we're talking about. So if we're talking about VA benefits, those don't coordinate with Medicare. You either use the VA system or you use Medicare. So depending on where someone is located, sometimes it is beneficial to enroll in the full Medicare benefits if you're in a rural, remote area where maybe you can't get to a VA facility as easily to get care. That way you have Medicare to pick up as needed. Obviously the flip of that is true if the VA benefits are easy to access and local. TRICARE for Life is a completely different piece of coverage for those who have put in the full 20 years and retired with full military benefits. And that TRICARE for Life is secondary to Medicare. So that's essentially a supplemental coverage to Medicare, and it is different than the VA benefits somebody would get through the VA system.
Oh, thank you.
Yep.
Colin, I see here a question about what is the difference between a Medicare supplemental and a Medicare Advantage plan. I think I'd like to hop on that one. It's a really good question. Medicare supplemental plans are also known as Medigap plans. They're sort of wraparound coverage that provides help with paying for things like your coinsurance, your copay. Medicare supplemental plans are only available for purchase if you are enrolled in original Medicare. You cannot buy a Medicare supplemental plan if you have a Medicare Advantage plan. Medicare Advantage plan also sort of offered through private health insurance companies. Medicare Advantage plans is going to be your alternative to original Medicare. That's where you get your Part A, your Part B, your Part D through Medicare Advantage plans. And you often, may pay an additional premium there. But Medicare Medigap, that's the terminology for a supplemental plan. That's just sort of like it's a supplemental. It's supplemental to the original Medicare, and you cannot have a supplemental plan if you have Medicare Advantage.
Great. Well, I know we have a lot more questions in the chat, but unfortunately, I think we're kind of running out of time. So, Trisha, I just want to say thank you again, and encourage everyone to be on the lookout via email for all the links that were mentioned and a recording to be shared after that. But we just thank everyone for the time and participation today. And we'll, please follow up with us via email if you need anything in the interim. But Trisha, any kind of final comments or questions for anybody else?
Just thank you. Thank you to Rebecca Kinney for joining and talking about SHIPs. Thank you to you all for taking the time to digest Medicare. It's a lot, I know. In many cases, there's just so much to kind of keep track of. Things change. That's why we always encourage to, review existing plans and coverage and provide support to your staff. And when it comes to reminding and referring and pointing people to services.
Great. Well, thank you all. And thank you, Trisha and Rebecca. This is now the end of the webinar. I hope everyone has a great rest of their afternoon. Thank you. Bye.